My name is BJ Kraemer. I am the president and CEO of MCFA, located in Haddonfield, New Jersey, doing program management, support services, and advisory work to large-scale, complex projects. We were involved in a complex program, and speaking with the client, it was pretty apparent that risk and safety were kind of the issue of the day, and it was holding back this large-scale enterprise implementation as they started piloting deployments of a new EHR system. Safety and risk were kind of the red flags, and they needed expertise and they needed it quickly. And it was kind of right people, right team at the right place at the right time. It enhanced the conversation immediately. And it was almost like we were able to roll up our sleeves and get to work with the client to understand their program and their problems. It was not just instant problem solving, but it was also instant credibility. The organization is about as large and as complex of a healthcare system as you're going to find. Hundreds of thousands of patients, very diverse population, and really navigating risk from a legacy EHR system and seeing indicators that they weren't quite ready. So they wanted to, in our words, assure a safer transition experience. Credibility that was established immediately had to really come down to two things: the experience of the team coming out of Harvard, having done complex deployments internationally, and then along with that, the grasp library of controls that they had built that really just gave everybody a sense that more than best practices or a checklist, this was a complex library of controls that EA brought to the table. It was obvious from the start that we were bringing expertise to the table and that we understood the problem set better than the client understood their problem set. And I think that really is what gives you instant credibility. And we could immediately start making an impact. I think one specific example that comes to mind is pretty early on, after we were engaged and got to work in 3 clinical areas, we were able to identify 126 risk issues and recommended controls to mitigate safety. The EA healthcare team eventually will prove that they understand this space better than anybody. They bring the expertise, they bring the experience, they will immediately start making an impact and helping you seek to understand and define your problem. EA is my go-to partner for healthcare safety. We're expanding into not just public markets, but private and institutional healthcare and nonprofits. And without a doubt, I am bringing the EA healthcare team to the table with me whenever I'm dealing with healthcare problem sets and specifically healthcare risk and safety.